Assalamu alaikum. Today we'll have a prospective clinical study that evaluates the healing outcome of periapical microsurgery in teeth with and without internal defects. The study was conducted by Tawil and colleagues and published in JOE in 2015. Despite advances in microsurgical protocols and materials, failures still occur. One suspected reason is that the internal defects may serve as a route of bacterial infiltration or propagate into fractures, but their impact on healing has not been clinically evaluated. So the aim of this study was to assess whether the internal defects, such as crazy lines or cracks on the root end, affect the healing success after periapical microsurgery at 1 and 3 years. It's a prospective study conducted in a private endodontic practice. They had 155 teeth received periapical microsurgery, and teeth were included if they had persistent apical periodontitis. However, cases with periodontal complications, perforations, or mobility were excluded. Standard microsurgical techniques were followed, including a 3 mm root resection. They used a transilluminating lead prop and methane blue to inspect for cracks, and then ultrasonic tip were used to prepare the root end, and they used retrofill material like MTA or Super EPA. They had 2 groups, either intact, which is root with no visible lines or cracks, or dentinal defect, root that showed any disruption in the dentine regardless of dye staining or tactile catch. They defined healing as complete resolution of radiolucency and reestablishment of the lamina dura. Clinically, also absence of signs and symptoms. Radiographically, they followed Rudd and Malvern criteria, and they considered incomplete healing, which is scar tissue healing, as not healed. Moving to the result, dropout rate was 14% at 1 year and 18% at 3 years. The healing outcome was at 1 year in intact group 94%, and in dentinal defect group 29%, and the difference was statistically significantly. At the 1 year, intact group showed 97% healed, while dentinal defect group had 31% success, and also it was significantly different. For the probability of not healing, the 1 year dentinal defect had a 0.65 higher probability of being not healed. However, at 3 years, dentinal defect had a 0.66 higher probability of being not healed. So we can conclude that from the study that intact roots heal significantly better than those with dentinal defects. Also, dentinal defects strongly predict surgical failure. These findings may assist clinician in outcome prediction and treatment planning, and also this study recommend using transillumination to detect the defect during surgery. And thank you.